Good morning, everyone. Thanks for joining us. Hope everybody's hanging in there so far this morning. Welcome to our session titled Advancing Global Workforce Mental Health Care, Science, Accountability, and Demonstrable Results. I'm Paul Wilson, and I'm Editor-in-Chief of Benefits Pro. And for those of you who don't know, that's a publication that provides news, analysis, best practices, and strategies for benefits professionals. And so I'm really excited about our conversation today. We have a rock star panel up here, and I'm going to just let them all introduce themselves and maybe just share a little bit about why they're here and what this topic means to them.
Great. Thank you. My name is Erin Young. I am a benefits consultant at WTW, and I am our clinical leader for mental health for our national and global mental health services. I'm a clinical social worker by training, so mental health has been the fulcrum of my career, and so the ability to support clients from an employer standpoint in terms of their benefits, strictly around substance use disorder and mental health, is a privilege and a passion. So I'm happy to be here to talk about quality and all kinds of good stuff. So, Carrie?
Hi everyone, I'm Carrie Bergen. I'm with Lyra Health. I've been in the mental health industry for, I hate aging myself, but over 20 years. I started in direct practice. I'm also an LCSW. And I did many years of private practice, nonprofit work, focused on health equity. And then I moved into corporate mental health, and I've been in various clinical roles as well as sales. And I came to Lyra to really oversee our strategy and really help build a business case with employers who are considering purchasing Lyra, and then once they do, continue to talk about strategy and how we can remain innovative and really make sure that we're meeting their needs. And it's so nice to see so many familiar faces in the audience here, so thank you all so much for joining us today. I will pass it to you.
Hello and good morning, everyone. My name is Matthew Saxon. I'm the Chief People Officer at Zoom. I, first of all, actually just want to say, for those of you who work in the field, who are passionate about helping others and who show up and show care to those around you, thank you. The last period of time in life and society has been really tough, and the work you do matters. Trust me, I see it every single day. So I just wanted to start by saying thank you for everything you do for those around you. I'm really looking forward to the discussion.
Hi, everybody. I was going to say thank you. I agree. The work you all do is really impactful, and so I just also want to say thank you. My name's Sophie Salvatore, and I work at Salesforce. I'm a part of the global well-being team, and my background is in benefits and in design and strategy, as well as innovation. So it's my pleasure to be here.
Great. Well, thank you. I told you we had a great panel. So during our prep conversations, we kind of came up with some key talking points for today to kind of focus our conversation and keep us on track. And so we came up with three kind of key pillars that we're going to be talking about today: innovation, access, and value. So let's kick off by focusing on value. Matthew and Sophie, this one will kind of be for you guys. I'd love to hear your thoughts on how employee mental health aligns with both your company's core values, but also your own personal core values.
Okay, I'll go. So at Salesforce, which is the world's #1 AI CRM and the home of Agentforce, which I don't know if you've seen that new announcement, we're really excited about it. We have 5 core values that include trust, customer success, innovation, sustainability, and equality. And so our commitment to mental health and well-being is more than a program or an offering. It's a reflection of our values. And we know that during this transformative time of AI, the minds of our people are the most important asset we have. And so helping them flourish is our #1 goal. And we truly believe that we're all employees, right? And we're all people. When we feel connected and heard and respected, we are more creative. We thrive and we grow. And so we see a direct connection to our mental health strategy and well-being strategy as a part of that. And then as a person and a Black woman, caregiver, and mom, I am the first person in my family to go to college. I'm the first person in my family to go to therapy. And I've never said that out loud. And earlier this summer, my son was diagnosed with 2 rare kidney diseases. And I know firsthand the complications of a chronic illness, and the impact that a mental health strategy has is tangible, and it's also driven by culture. So I'm fortunate to work in a place where I can be both a high performer, a caregiver, and someone who goes to therapy. And so that is why we care about it and how it is amplified by our values.
I really should have gone first. Wow. It's hard to follow that. So for me and for us at Zoom, I think, and I'm sure we'll talk later on about tactics and ROI and technology and, all these great things. But it starts with the why, right? That Simon Sinek sort of start with why. And for us, it's rooted in values as well. And we have one core value. I remember when I was interviewing with Eric, our founder and CEO, and I said to him, like, what are your values? What are the company values? And he said, care. So I wrote that down, and I sort of paused, waiting for more. And I said, is that it? And he said, yeah, think about it. And so we have 5 dimensions of care. Care for company, care for customer, care for teammates, care for community, and care for self. And when you start to unpack it, it's like, oh, actually, if you do care, if you truly care, yes, there is some ROI, and we've got to make sure our investment is the right one and it's having an impact. But the why you do it is because we care. And so a lot of times I will talk to our benefits team and I'll say the employee support network is the ultimate head and heart, because it really does impact people's lives. It really, really does. And that impacts your organization, and that impacts your customer. And so the value chain is really, really simple for me. Lead with care, and the rest will sort itself out.
Oh, that's great. Thank you. So, Erin, I mean, you're coming at this from a slightly different lens, but I would love to hear your thoughts as well on, what is the value of investing in quality mental health care?
That's a great question, and I wish that I could follow that conversation, because I think that when I work with organizations, we talk about this organizational strategy, and I love to talk about these values and the commitments and the pillars that organizations apply to their people. But from a business perspective, there's also a different level of value that is brought when quality services are brought into that healthcare ecosystem. So there's many, I'll touch on 3 right now, but there is a straight benefits value. So the ability to offer benefits that are consistent across a global workforce, a national workforce, that has quality behind it, that everybody can access, right there is an optics play that is very important for employers, that also demonstrate their ability to walk the walk of what of these commitments and values that you're talking about. There is a literal clinical value. So when you're providing high quality care, that inherently leads to personalized support for an individual's journey, right? Mental health care is not cookie cutter, it shouldn't be. But that also means, as you're looking across the globe, hyper-localization, understanding globally what communities need and want. And as you apply that quality and that mental health element, you can reasonably think that there will be less of a healthcare burden across other parts of the healthcare system once people start to take care of their mental health. And then, finally, there is a value on safety. And in the US, we really don't lead with this often. We talk about other reasons for mental health and supporting mental health, but the safety value is really critical globally. It's where we see more of an impact, especially for our Asia Pacific regions, in our Middle East. That safety play is really important, so we can bring people along into engaging in mental health. So when employers put forward quality mental health services, they're putting a stake in the sand around psychological safety, personal safety for their employees, workplace physical health safety. And so what that does is also helps to decrease incidences related to their most valuable resource, which are their employee base. So you're decreasing some of those critical problems and issues that you have. but you're also decreasing your risk exposure on the financial side for workplace and safety incidences. So those are three that I can touch on. There's many more, but I'll wrap with that one.
No, that's great. Thank you. And I love what you said about walking the walk because, I cover this industry and the healthcare and benefits industry all the time. Over the last 5-10 years, there's been a lot of mistrust from employees because employers are saying one thing and doing something else. And so I think what you said there is really important. The concrete benefits that show that you're actually doing what you say you care for, or that your core values are actually, showing up in the benefits that you provide. I think that's really good. So let's shift gears a little bit and focus on another one of our 3 pillars, which is innovation. So this one is going to be for Carrie, Sophie, and Matthew. And Carrie, I thought maybe you could kick this off. Can you each talk about your perspectives on how you and your company are innovating to improve mental health care across diverse global populations? The challenges you faced and maybe some of the strategies that you're using to overcome those challenges.
Yeah, absolutely. I think when I hear the word innovation, sometimes my brain directly goes to the shiny new thing and like, what's cool and what new technology do you have? But I think innovation also can incorporate equitable care, and how are we innovating to provide equitable care? A lot of times when we talk about multinational employers or groups, I hear the phrase a lot, mental health parity globally. And I don't know that really captures what equity looks like within the mental health space. And so I like to frame it as not just parity. When I think that, I go back to my consulting days of restrictions and copays and things like that and how they apply in the U.S. But considering what health systems look like outside of the U.S., I think it's a lot more. And it's how are we reaching employees and making sure that them and their family members are receiving care that's going to feel as rich and as accessible, as it would if you were sitting in the U.S. I think that's kind of been something we've seen within global mental health, of folks who sit outside of it saying, everybody in the U.S. gets so much more than us, why don't we have access to this? And something that Lyra has done is built a clinical global council. So we have local clinicians all over the world who come together to build evidence-based treatment standards, quality of care, and making sure that it looks appropriate for that region or for that country. So taking into consideration what the nuances are, what the local laws are, what the health system is, what the national government organizations might be, and then making sure that comes through within the person's experience, whether it be in person, coming through the product, and then capturing that through our data as well. I think it's so important that your data can tell a story. And if we're doing something in the US that's great and we have all of this data, but we're not doing it with our other locations, what is that worth? Not too much. So in terms of innovation, we're really looking at the full story of equitable care and making sure that access and the quality lies within the U.S. as well as every other country that we're in. And we're in over 200 countries and territories. So that's kind of what my thoughts are on that. And I think, we've seen that. One other thing that I'll just call out before I pass it on is we work with great companies like Zoom, like Salesforce, and continuing to co-innovate is also very important to us. So if we call our customers or our clients partners. If we have a partner who's saying, our folks in India need this, or our folks in the UK need this, we're going to partner and make sure that what we're offering is going to meet their needs. So innovation continuously, and making sure that we're working to be the best benefit that we can be at all times.
Yeah, I'll take the question in 2 parts, actually. The first part is like, if you look sort of inside as in terms of what are we doing, and then I'll talk a little bit about our product. I think there's two things. One is context is really important, and the way we work has really evolved in the past couple of years. And the boundary lines between work and not work kind of gotten blurred. And there are a lot of benefits to that, but there are some things that I think we all need to be aware of in terms of like making sure that there is space for people to like just put these little wonderful things that we all carry around with us, our phones, etc., is to have time away from those things, is to make sure that we are working in a sustainable way. And I talk about, over the COVID period, we were like, can we survive? Can we, as individuals, as companies, as societies and communities, can we survive? We've checked that box by and large, yes. The question now is, can we thrive? And that's a much higher order question, I think, and requires a lot of thought and great partners. And I am proud that we are a partner of Lyra's, to make sure we can meet people where they are, because people have needs that as a teammate, maybe I'm aware of, maybe I'm not. As an employer, maybe I'm not, maybe I am. But our goal is to make sure they get the support they need kind of when they need it. There's a temperate element to that. Something's happened in life and someone needs like support, and there's others that is sort of more of an ongoing support model. And so I think the innovation is making sure we can be where our employees need us at just the right time, so they can access it sort of on demand where they need it. So that would be one point. On the product side, I'm sure many of you know Zoom as sort of meetings, but we do a whole lot more than that. And we really do see a big opportunity to leverage things like small language models specifically within the healthcare and behavioral health space to support providers, clinicians, etc. And we're innovating now to use our AI pilot to actually embed into systems of record, so that a provider isn't sitting there with a patient, in front of them, tapping away, and they've sort of got to split their time between the two, whereas our tool can then transcribe that, put the key information into the system of record that enables that person to be more fully present with that person. And so there's some really cool innovation that I think we're doing on the product front as well that's really exciting.
That is really exciting. At Salesforce, we always knew that we wanted it to be more than a program, that we wanted to build a culture of well-being and mental health support. And so our innovation has taken the approach of meeting people where they are at the office, at work. And we all go to town halls, we all go to meetings, so we have a mental health town hall every year. And it's a way that we walk our talk. We show our employees at every level of the organization, including the absolute highest level, we care about them. And we talk about mental health, and our leaders and our colleagues share their firsthand experiences, whether it's looking after themselves as individuals, looking after a teen or an adult. We also really are focused on the interconnection holistically of mental health, and working and innovating with broad solutions in the health plans, and that includes systems outside of the US, because through our partnership with Lyra, we do offer Lyra globally, which is, to amplify what Erin said, is a core piece of our strategy, and that strategy is also localized. And finally, we always want to provide the highest standard of care. That is extremely important to us because of the very real impact it has on families and employees. And because of that, we've done some deep work on essential minimum standards, and we're very proud of it. We hold ourselves accountable to it in every single country. And that innovation is done in partnership with Lyra, who has really allowed us to make those standards localized. So the way that those standards look in every single country is different. And so in addition to having a wonderful partnership, we are looking for small incremental steps we can take every day, every year.
That's great, and that leads perfectly into my next question. So, again, covering the industry, I hear about cost. That's probably the biggest thing that I hear about that drives every news story, every broker I talk to. I mean, that's what they're focused on, but that ties directly into access and quality. They're all, very much enmeshed in one another. So I wanted our next question to kind of focus on that. And Erin, could you talk a little bit about just key factors you look for to ensure both the employees and the employers everywhere have access to high quality care?
I think that this is a great segue from talking about those global minimum standards and what they are. And so if that's a new term for anyone here, it's really just nothing more than the essential building blocks and services that are foundationally available regardless of your location. Now, in my opinion, those minimum standards across the globe are as simple as a clinical assessment of need, but then access to the services that are indicated by that assessment. So across the globe, unfortunately, we lack global minimum standards for very good reason. So when you look country by country, there's a lack of providers, simply. There's also different credentialing requirements, country by country, different licensure, different education, different expectations on how you need to demonstrate that you can effectively provide mental health care. I don't know that we're ever going to align on what that looks like for a global, a way to look at that cohesively, that everyone's looking at it the same way. When we work with organizations, so it's amazing to hear that Salesforce has these minimum standards. We talk about setting what those may be. And business for business, that could look different. So business A might only be in the US. Those minimum standards might look different than someone who is in 200 countries or 30 countries. And so we look to establish those minimum standards that we can measure and hold vendors accountable to consistently for a business to be able to apply those benefits consistently and provide those services. So there are definitely, access standards that we look for, quality outcomes, standards that we look for, but there are, every company can have something different. You want to add in on your minimum standard?
Yeah, sure. I think one of the ones we really focus on, and I'm a benefits professional, so we always care about the number of days to care, for example. So in the US, as I'm sure many of you know, the average can be 6 weeks. In the UK, it can be 3 to 6 months, and that's a completely different system, right? And so at Salesforce, we're very proud of the fact that in the US, our time to care is a day. And outside the US, it's 2.8 to 2.9 days. And that matters because we all know that the sooner we get to care, the better we get, the faster, right? We go from languishing to flourishing. And it's not all about speed, but that is something that can be measured and it can indicate quality. But I think also when we talk about quality doesn't mean the same thing for everyone. We're not all looking for the same provider or the same type of access or same type of care. We have individualized needs. So I think, in partnering with colleagues and teams, that's an important thing to highlight, that everyone is deserving of having a seat at the table to share their view based on what they know about your employees or your teams.
Great. Thank you both. Just wanted to make sure the question was mainly to those two, but did either of the other two of you have anything to chime in on there? Nope, okay. No, we'll move on. So we'll keep talking data, but I want to move it to something Matthew alluded to earlier, which is kind of the business case. Historically, benefits in general, and in particular wellness, mental wellness, financial wellness, and physical wellness have been one of those things that's kind of hard to sell to some companies because it's opaque, it's kind of squishy, it's a little soft, at least, that's the way it's viewed. But that's really starting to shift. There's been an increased focus on regulation and a lot, or not just regulation, but transparency. And I was going to say a lot of that is driven by regulation, but it's also due to the innovations that are taking place, within our industries outside of that. And so I wanted to just talk to each of you a little bit about that. Like I said, when I cover the industry, a lot of the conversation when it comes to the benefits conversations that you deal with, Aaron, now involves the CFO and the CEO, which historically they weren't in on those conversations. It was often an HR thing. And, go talk benefits with HR and we'll talk to you later. But now that's changed. CFO and CEO are in every one of those conversations. And so it's changed the language that a lot of consultants and other people are using because they realize they're talking to somebody who needs those hard numbers. So that's my long-winded way of asking. So what data and insights have helped you make the case, Aaron, for global mental health care investments to the C-suite? Because I know that can be a tough conversation.
Yeah, we could also be here for the next 2 days because my soapbox is quite big on this. So I will level set by saying I actually don't know if everyone in the audience knows what a business case is. I actually didn't before I went to business school. I needed to do this on the carrier side. But really, when we talk about a business case, we're talking about the justification for an employer to invest new dollars or additional dollars in a service or a program. I will say, I have my colleague Carrie here from WTW. When I am asked for the business case, it's absolutely my most unfavorite part of my job. But the reason is I'm a clinician at my core. And when I'm asked for a business case, I get this very visceral reaction. I get this reaction that feels like it eats away at the whole reason that I went into this career, right? That I have to justify down to the nickel why mental health should be a priority. And I hate it. I just hate doing it. But it's important to tie this in because mental health is really nothing more than physical health, but we like to separate it. And we separate it because I think a lot of people feel good being able to put things into buckets, but we've been working so hard to try to create this holistic view of mental health. So I don't like it, but I do it. So when we do this business case, I think it's really important to understand also why, because many of you in the audience who have created these new services or solutions like Lyra, these are solutions that cost a lot of money. And we're talking hundreds of thousands to millions of dollars that need to be smartly allocated for purposes of mental health. Now, companies like Lyra and others have very, very smart people that put these lovely savings analysis together that we can use, smarter than me, that we can use to build these business cases. But it's really important that people understand that there's a lot of assumptions that are predicated on these business cases. And those assumptions, we try to get really narrow on what can be expected because it makes everyone feel comfortable. Some companies need it. They need to have a very specific line item. It needs to be fixed. We can't stray from that. But there's a lot of variables that you can't account for in what may or may not make a solution successful. And that could be on the employer side. That could be how well you promote that benefit. If you just put it in and don't tell your employees about it, how can you expect that it's going to do anything? It could be on the vendor side, how well you engage and keep people in care. It could be driven by socio-political things that might be happening, right? It could be happening, things in the world that are happening, different regions that drive that. So we need to be able to appreciate that within this business case, we do our best to get down to the areas that justify that investment, but we need to have a little bit of wiggle room. Some of those hard numbers that we look at, so I should say we looked at what we refer to as soft savings, but are very real in terms of the workforce, things like attrition and turnover, presenteeism and absenteeism. But our employers really look at those hard dollars, those claims savings. And unfortunately, and I think that clinicians in the room will be able to appreciate this, is they look strictly at non-utilization as an indicator of success, when we know that in mental health, that is not an indicator of success. That just means that maybe for some people that's a success point, but it just means that people haven't found the right care that they've needed, or they've dropped off of care, or maybe they're not continuing the right care that they need. So it is our job as benefits consultants to take that and help a client evolve their thinking on what utilization means, and helping them track out that a solution like a quality mental health, investment or a program has a 2 to 3 year runway of seeing those meaningful results. And so this is not 12 months, 6 months in. You might see some great initial spikes in engagement. That's wonderful. But those really long-term sort of savings and justifications, you need to buckle in for that ride. And we talked a lot about the value, and this is where we like to pivot this return on investment case to more of a value on investment. So what does that program bring in terms of value to your organization. So that could be things like safety, right? Like that builds into the company values. It could be offering very robust benefits and being super competitive in the market and being able to attract that talent. It could be employee satisfaction and understanding what your employees need and want through their benefits package. All of these things roll together to create that business case. And it's important that if you're out there and you're talking and helping without consultant support, maybe you are trying to help an organization see that, these are the things that you need to roll in together. And then I'll end on this, that my hardest business cases to pass are with those people who have never had a personal or family experience with mental health. It is those people that have a hard time seeing the value in this. However, when we have someone who is a buyer or a C-suite person, CFO, CHRO, CEO for that matter, who has had or been touched by mental health conditions, their teens or children have struggled to get access, substance use disorder with their loved ones, suicide in their families or in their sphere. Those are the champions and allies that help move those business cases along because they are able to bring the humanity into what that means to make that investment. And so I always encourage you to look for those champions on the business side to help move that business case along.
No, that's great. That idea of humanizing benefits is so important because, numbers are one thing, but when you can bring it down to storytelling, and I mean, Lyra, actually, Benefits Pro does something that we call the luminaries, where we just try to highlight different individuals and companies who are doing great things in benefits, and Lyra actually won this year for humanizing benefits, so that's a nice little segue because I just think that's such an important part of this whole equation is the human behind all of this. I want to make sure to give everybody else a chance to chime in on that if they'd like to, because you're all in on those conversations sitting in different seats than Erin is, but it's all part of, an important thing to look at. So anybody want to chime in on that?
I do. Are you guys? Okay. I just wanted to say thank you for that explanation, and you said it so eloquently. I feel like we all go to these conferences all the time, and we hear ROI, ROI, ROI. When I joined mental health, there was no talk about ROI. It was like, and it's so dismissed by so many. When I was a consultant, I'd kind of be like, take your ROI, and, I want to look at it myself. And I will say that there, of course, is absolutely a return on investment when we have access to health plan spend, and we can look at all of those different data points and tell the story of here's where your claims are now, here's where the cost shift could be, and we think that we would be able to do it in a way where you do have a return on investment. But when we think about multinational employers and organizations who are global, it's very hard to do that outside of the US because we don't have claims information, right, for most countries. And being able to weave in the points that Erin talked about in terms of retention, productivity, absenteeism, all of those things, and then also attracting talent, right, and keeping your talent. I think there was a stat from my Mercer friends that I saw not too long ago that the Gen Z population considers a mental health benefit one of the top 3 attractors to a company. And if you don't offer mental health, they're not even going to consider working there. So I think we're seeing a kind of change within the way we think about mental health is now part of health, but it's one of the most important parts, right? Because it's so comorbid or so co-occurring with so many other things. And it's really important to be able to not just check the box, but have that investment in a really quality service.
Maybe just one last thing. I know. I also think that there's inherent stigma that is involved. And I think that we do need to acknowledge that because, you can go and have a lab test and it's very clear that you have a diabetes, diagnosis or otherwise, whereas like you don't get that with mental health. And so I do think that the measuring stick at which mental health solutions are held to, justify that investment does feel higher than maybe some of the other clinical condition counterparts that have been out there and maybe pressure tested. And so, as we all think about stigma and really like what that means, I think that we also do have to think about how stigma does like pervade even like the business use case and the understanding clinically about like what mental health is and the value.
No, I'm so glad you brought that up, because that's something I wanted to ask Sophie and Matthew, is that idea of stigma. I mean, yes, I think to some degree it's starting to change. To your point, I mean, it's starting to be acknowledged as a part of core health. But what strategies and tactics are you using within your own companies to kind of help overcome some of those stigmas that may still exist, or to make sure you keep moving that needle?
Sure. Yeah, I can share. So just a very real example, at Salesforce about 4 years ago, the team wanted to put forward like a training. We have this wonderful platform called Trailhead, and you all can join it and see our mental health trail. There's also one internally that you can't see, but it's a great platform. And there was a debate if we could say mental health. That's where we were 4 years ago. So everyone is starting somewhere, right, on their experience in their company. And today, because the team was resilient and persistent in destigmatizing that, we're able to have the trailhead, talk about mental health. And so I think it's just acknowledging that there are structural and cultural barriers when it comes to stigma that are both personal and global. And also that some of them you can't see, right? Like Salesforce is not a company that you would think we're having that conversation, but we're very intentional with everything that we do. And so it was done with very clear intention on purpose. I think also we focus on local efforts, so it's not a one-time thing for us to work on stigma. It will be something that we double down on every year. And this year, in fact, we had over 1,000 managers in India get together and talk about the value of and the importance of mental health. And that's just one example of many, and there's so much more that we're going to continue to do.
Yeah, I agree. I think it's an ongoing discussion, and it's something that I think the more we talk about and the more we understand, and I love Erin's point about like putting a face to it and having someone to share their story, it hits you. And you want to lean in, and that person that's showing a great amount of courage to share an experience or a story, you can't help but want to lean in and sometimes like give them a hug or like, and be proud of like, what are we doing to help that person and then help others, because you don't know. We can't see what people are carrying with them, but knowing that there are tools and there are avenues there for them to talk about it, to see someone, and to have the support that they need, I think is just super important. If I can, I just want to go back briefly on the ROI thing. I sit in a lot of meetings about investments, and here's what I'll tell you in my experience. It's never about should we do this, is it a good idea? Never. It's about where does this stack in our priorities? And if I've got $1 to spend, do I spend it there or there or there or there or there? And you are, at the end of the day, competing with where do I need to spend? That's both within my own portfolio, looking after the people team. So do I spend it on, do I spend it on behavioral health? Do I spend it on benefits? Because now you're like, well, do I put it in 401k? Do I put it in my pension matching program? Do I put it in something else? Then I go to, well, do I put it in merit increases? I'm staying even within the reward space. Now do I put it in talent programs? Do I put it in manager training? Do I put it into onboarding? And now I'm going outside of my world and going into now how do I think about whether I want to spend that dollar here or whether I want to invest in AI, which is a super expensive game to play. And so I just kind of say that. So I kind of think about it just in simple terms. What do I give? What do I get? But I've not been in a discussion where someone is saying, this is why are we even talking about this? It's never that. And the more you can ease into the investment, particularly up front, the better. So if there is a model where it's a usage-based approach, or there is like, I'm much more inclined to go, yeah, we'll give it a go, because I'm not committing a whole bunch of investment up front to like, because everything looks great on PowerPoint presentations and on like the pitch. It always looks great. But I don't really know are we going to see that result? Are we going to have that traction? So the lower you can make the barrier to entry, for me to be able to make it easy for me to say yes, I'm going to be much more inclined to go, yeah, we'll give it a go. So that's my own experience as you think about these things.
That's a great point, and it ties into the last question I wanted to ask, but before I did that, I just wanted to make sure, Carrie, did you have anything else you wanted to say about stigma before we moved on to our last question?
I mean, I think, Sophie, you really led into it, but especially where mental health isn't as well received and isn't a top reason to attract talent or keep someone, I think having those ongoing points of engagement and education are key, and also really making sure, as you said, which I loved hearing, that you're tailoring it to the population. Like you talked about India a little bit. We don't say mental health in India. We did this huge campaign on road rage, and all these men came and they were like, I'm angry when I drive. And then we segued into wellness and how do you kind of relieve that stress. And so I think knowing your population, localizing it to the nuances of that, and being really respectful and mindful of how to engage is crucial.
Oh, that's great. So we have about 3 minutes left, so I thought I'd just start at the end and we could just do like a minute or so, just ending on a positive note. We've talked a lot about investing in mental health, but why is it a good decision? What are some of the positive ripples that come out of that, and how does that kind of tie into what you're planning for the next few years?
Yeah, great question. So first of all, thank you for letting us participate, and thank you for being here today. I'm really, really grateful. I think there's so much to celebrate. Especially when we see the people in our lives that are getting care and are being looked after and do have access to quality, right? Personally, I am really excited about AI. I'm seeing just in 3 months how my son's pediatric nephrologist and pediatrician are embracing it, whether it's notes, and I'm really excited to see how large language models are going to scale to be able to enable people to have access to their information and their records, and how each of us can optimize what we do and be even better and more excellent at our jobs and learn faster. So I'm very excited about that. I'm also excited about something that my manager, Felicia Chang, shared with me. She said, Sophie, what about all the things that a therapist can't solve for? And that made me think, that's right, because there's more to do in the workplace, whether it's getting those internal signals, enabling people leaders, that just, my brain kind of exploded like, oh, okay, let's go. So, over to you.
Focus on progress, not perfection. We are making, I think, strides, and that's off the back of you all and passionate people who care about others and who want to give care to those that need it. We still have a long way to go, I think. It requires continued focus, continued investment. I do agree that I think technology will help enable this, but at the end of the day, we're talking about people and the care that people have. I am tremendously excited about what is coming up and what is on the horizon. And again, I just want to say thank you all for everything you do.
And I would say I completely respect what you said about it's never we don't want mental health, it's competing priorities. But from where I sit, I feel like we're in a space where for the first time, if ever, it's a mental health and not a mental health or. And so I think if we can continue with that spirit of making mental health a priority and keep moving forward with what COVID gave us, right? We all had some type of experience. We're all talking about our emotions, and the world's not getting any easier to keep pushing for strong mental health care and being able to be there for each other. And also, I think work design, time away, policies and procedures that really allow your people to utilize the mental health services that they have. Because we can talk about burnout and how to address it all day long, but if you're expected at work to, look at your email at 9 p.m. and respond by 9 a.m. That's not gonna, support a culture of prevention or psychological safety or mental well-being. So, keep being advocates, and thank you all for being here today.
And I'll, I guess, wrap us up here, but I would say that the ripple effect that I'm most pleased about is actually the inclusion of the discussion in the workplace. So what I see from a benefits perspective is that we are seeing mental health considered across the business more intentionally. So whether that is things like return to work, whether that is workplace design, whether that is benefits, ERGs, big decisions that happen in maybe with changing other medical providers and what that looks like in terms of equal benefits. And so that discussion, short-term disability, or looking at life insurance policies that you have and removing suicide exclusions. So a very intentional lens that has been applied is what makes me the most happy, is that people are thinking about this just very intentionally. And thank you, everyone, for listening intentionally to us.
Yeah, I just want to echo what they all said. Thank you for everything, all the work you do every day. It is noticed, it is appreciated. Thank you again to our panelists. Can I get one more round of applause for them? Great, thanks so much, and have a great day, everybody.